Hello everyone. Today's video is about a successful treatment of a patient dealing with post-Lyme disease syndrome. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So someone posted a question slash, I guess more of a comment on one of my other videos a little while ago, saying something to the effect of, it would be really great to hear some basically anecdotes, some clinical stories about successful treatment protocols for folks dealing with different types of complex chronic illness. I think the video that the person was posting on was about mold illness, but just kind of got me thinking that I post a lot of videos, answering questions about this and that, but haven't really posted a lot of content just talking about, what a successful protocols look like. I've talked about, what a comprehensive treatment for a mold illness would look like, or a comprehensive treatment for, a chronic infection like persistent borreliosis would look like, but haven't really necessarily talked about what that actually maybe looks like in clinical practice and in a kind of real life scenario sort of thing. So anyways, I'm going to post a few videos like that, and we'll just see how it goes. So hopefully they're of use. As per usual, I always appreciate comments in the comment section, and questions, and the questions are great because it gives me things to talk about that I know that folks are interested in, at least one person is interested in hearing about. But if you enjoy these videos and post a little bit of feedback just saying like, yes, this is good, or you like more of those, then I'm happy to do those, because I have lots and lots of cases, and thankfully many patients have got better over the years, or have improved dramatically to the point where they're very happy with where they're at. So anyways, I'll stop with the prelude here and talk about this case. So this is a case that patient I was working with probably about maybe 4 or 5 years ago, kind of measuring everything and like, was it pre-pandemic or post-pandemic? So anyways, it was a pre-pandemic patient. And so this patient was, generally healthy person, like pretty busy, burning the candle at both ends, but was feeling good. Then in the summer, I think it was a tick bite, got Lyme disease as a diagnosis, developed the bullseye rash, kind of typical thing. And then they started, getting joint pain, fatigue, and whatnot. Went to see their family doctor, got put on doxycycline right away, was on it for 2 or 3 weeks. And this patient was kind of one of these rare cases relatively rare cases that just had no benefit from the doxy at all, maybe like a 5-10% improvement, didn't really feel any better at all. I think their doc gave them an extra, week-long, extension of the doxycycline. Still didn't feel any better from that, or there was no further improvement, and their doc said, well, like that's the standard of care. I've given you the treatment for the Lyme disease. It looks like you have post-Lyme disease syndrome, and there's just nothing else. You just have to wait to get better. It's like, oh my gosh, what a terrible thing to be told. I mean, it was an honest opinion, that is the standard of care here in Canada. I believe it's analogous according to the Infectious Disease Society of America down in the US, but it's really disheartening to be like, well, you gave me the treatment, it didn't work, I feel like garbage, and I have no recourse. So the patient was very upset, felt like she really couldn't work anymore. She had 2 kids, single parent. It just was not a good state of affairs. She was very, very upset and emotional when she came in to see me. So this was, several months later. She was, not feeling any better. Things did not spontaneously get better. She was really struggling to work. And so I said, well, we can, do some lab testing. We could do some ELISpot testing through Armin Labs, or some analogous type of testing to see if there's still, evidence of ongoing infection or whatnot, or we could just do a therapeutic trial. Let's put you on some tinctures. So I've talked about kind of my favorite combination of herbs before, inspired by the late, great Stephen Buhner. So do you want to do a therapeutic trial with the tinctures, or do some testing, or, what do you want to do? My advice was, I think we should just treat, because we obviously had Lyme because of the bullseye rash. You didn't have a response to the treatment, but doxycycline doesn't clear up every case. We know that it has a approximately like a 10 to 20% failure rate for Lyme. So let's just treat you, but gave her the option of testing. She said, no, let's just treat. So I put her on a couple of herbal tinctures, containing the aforementioned sort of favorite combination of herbs. So herbs like Cryptolepis, Alcornia, Sida, Isatis, cat's claw, Japanese knotweed, What am I missing here? Chinese skullcap, if I didn't say that one already. Hutunia, I don't think I said that one yet. I've talked about these in other videos, so please reference those if you're interested. And no, unfortunately, I can't give dosage recommendations on social media, but recommended a robust dose of those herbs in combination, combination of a couple of herbal, she took two combination herbal formulas that encompass those 8 herbs, if I got them all right there. And so she went on those. Put her on, recommended some B vitamins as well, because diet wasn't that great, and just thought, well, she was having a lot of fatigue, like fatigue and brain fog were the most notable issues, but a lot of chronic pain as well. So I said, well, please start on some B vitamins. Recommended she, just reduce her intake of refined sugar and gluten in her diet, just as kind of general anti-inflammatory recommendations. So let's follow up again in a few weeks and see how you're doing. So a few weeks go by, comes back in, she's feeling a lot better. Joint pain was really down to a bare minimum at that point, or like down to maybe like a 1 or a 2 out of 10. Her energy levels were doing somewhat better. She was maybe 30% better with her energy. Brain fog was about 30-40% better. She was really relieved because she was actually starting to feel better, so that was very encouraging. And so we said, well, you know what, let's just stay the course with what you're doing. So she stayed the course. We followed up a few weeks later. In a case like this, we could have been working with intravenous ozone therapy or intravenous photobiomodulation, or we could have got some nutrient IVs in the mix, but she quite frankly just didn't have a lot of disposable income, and was busy with work and kids, and couldn't really come in for appointments very easily. I was like, well, you're moving in the right direction already, so let's just kind of stay the course. So we followed up a few weeks later. Pain levels were virtually obliterated at that point, which was wonderful. Energy was maybe another 5-10% better. Brain fog maybe 5-10% better. So she was doing better, but still maybe only about half of where she previously had been with her energy levels, and with her mental clarity. She was still about 50% more brain foggy than we would have liked. So at that point, I started to think, well, I use this analogy with patients all the time. It's the burning house analogy. If there's a house on fire, well, you got to address the gas leak that's started the fire or is exacerbating the fire. That's treating the root cause. So, okay, we've going after the Lyme. Well, we also have to put out the flames. We have to just because the gas leak has been addressed doesn't mean that the flames just spontaneously put themselves up. They're not being fed anymore, but they need to be put out. So we need to work with more symptomatic type treatment. And then after the fire's been put out, we need to actually repair the damage that was caused by the fire. So those are kind of the three parts of a successful treatment protocol for treating complex chronic illnesses in a lot of cases. So at that point, I felt like we'd probably addressed the gas leak pretty well, because she wasn't getting any further improved. She was only improving a little bit more in the previous 3 weeks. So that, okay, I think we've pretty much reached an end here. I recommended she stay on the herbs for another month just for good measure. But I thought, well, we need to start focusing a little bit more on the fire extinguishing and the rebuilding part of things. So she had the diet in the mix. So that was kind of a bit more of a fire extinguisher, putting out the flames, and also treating a gas leak, as she was maybe having one could argue that food sensitivities or food reactions could be kind of span a couple of categories there with the burning house analogy. But we weren't really doing a lot for symptom mitigation and kind of rebuilding and repairing. So I said, well, if your main symptoms now are fatigue and brain fog, those of you who have been listening to me for a while may be guessing what I was guessing or thinking at that point, is that we need to support your mitochondria. Mitochondria make all the energy for the cells. And brain fog is basically fatigue of the brain. So we really need to boost up those mitochondria. The mitochondria had been through a lot. She was obviously really hit hard by the Lyme. She was, super stressed because what's happening to me? Am I going to get better? Am I going to be able to keep working? Am I going to be able to take care of my kids? There was just a lot of hits against her poor little mitochondria. So I recommended she go on comprehensive mitochondrial support, which I've talked about in other videos, kind of a combination of B vitamins, amino acids, antioxidants, etc. I do have a online course. It's called Overcoming Chronic Illness. The first 2 modules are free if you sign up for my newsletter in the link below. And if you want to learn more about the comprehensive mitochondrial support protocol, it's part of the second module, and it's one of the complementary modules. So you can access that if you're so inclined to learn more. So this patient went on comprehensive mitochondrial support and followed up with me about a month later, came back, and she was basically back to normal, like 90% better, feeling great, really, really happy. Finished off the herbs, had no side effects or like no relapse at all from coming off the herbs. And so I felt like we effectively address that gas leak. So that was really great. She was on the mitochondrial support. So I said, well, I think you should stick with the mitochondrial support for now till you're feeling 100%. She was happy to do that. So she followed up with me a couple of months later, and she was back to where she was. She said, I actually feel better than I did at baseline, because leading up to it, again, she wasn't eating the best. She's kind of burning the candle at both ends. She's kind of a prime candidate for needing some extra mitochondrial support. And indeed, it was about 2 months before from our prior visit. So she said, I ran out of my mitochondrial support about halfway through. So like after another month, and I thought like, I'm feeling good. Like maybe I'll just see if I can do without this gross tasting stuff. Mitochondrial support powder is a wonderful formula. It just doesn't taste good. And so she ran out of it, and within a week or so, she's like, I started to relapse, and I didn't relapse back to where I was when I was in the depths of the Lyme, but I started to feel kind of the way that I felt before I got the Lyme in the first place. So not nearly as bad as she had been with the Lyme, but not as good as she felt on the mitochondrial support. She's like, I think I'm going to keep taking this mitochondrial support for the time being. So at that point, she was feeling good, and that's really the end of the story. With that, with this patient, normally I would have said something, let's follow up in a few months, see how you're doing, maybe work on some other elements of your health, let's keep you feeling as healthy as possible. Didn't hear from her again. I think probably because she was feeling good. We kind of did the job that she sought me out to do. And she was busy, feeling good, and not everybody wants to biohack and try to work on their health optimization moving forward, and that's okay. I'm here to provide whatever services a patient wants, and if that's where they want to leave it, that's great. But it's a really good cut and dry case, and just a nice example of yes, we have some powerful antimicrobial tools that we can work with in the form of herbal tinctures. We have powerful tools in terms of boosting up mitochondrial support, and she was just a really good example of both of those types of interventions working well. So I'll leave it there for now as far as the story goes. If anybody has any questions or comments about this, let me know. I mean, normally it's more of like, I'm talking about a topic and not really giving a little case presentation. So I'm not really sure what kind of feedback or questions people might have, but if there are any questions, please feel free to post in the comment section below. Again, I can't get into dosages. I'm just not allowed to do that on social media based on my regulatory college rules, because it's construed as medical advice. Yeah, any questions or comments, post in the comment section below, and I will get back to answering questions as well. I have several in the queue that I need to do videos for, but I thought, I'll just do a couple of these because it was inspired by a comment on one of my other videos. So I hope that this was of interest, and I will leave it there for now.